Hey there, it's Dr. Jim Collins. Thank you so much for spending some time with me. Good topic today. Parkinson's disease and the risk of suicide. A very important topic, a serious one. Experts indicate that a number of suicidal risk factors do exist for individuals diagnosed with Parkinson's disease. And I think we've known this for some time. Depression is particularly common in people diagnosed with the illness. Around 17% suffer from major depression, and another 35% experience significant depressive symptoms. Other risk factors associated with suicide include anxiety and insomnia, which are associated with Parkinson's. So Parkinson's disease is a progressive neurodegenerative disorder that is diagnosed primarily by the presence of motor symptoms, including bradykinesia or slowness of movement, resting tremor, and muscle rigidity. There are also non-motor symptoms like depression and anxiety that lead to its diagnosis. And these all cause a decline in well-being and quality of life, putting the individual at risk for being admitted to a nursing home, and are predictors of overall mortality. So take all of those motor and non-motor symptoms together, and they add up to very dangerous situations for the individual. Symptoms start gradually with Parkinson's, almost unnoticeable at times, and then they become more severe as the disease progresses. Here are some risk factors for suicide according to the literature. While depression, anxiety, and insomnia are the main neuropsychiatric risk factors associated with suicidal thoughts and behaviors, there are other important factors to keep in mind. Men, especially Caucasian from European descent, who are diagnosed with Parkinson's, are more likely to try and complete suicidal attempts. Individuals with pre-existing psychiatric conditions like bipolar disorder, alcohol or substance use disorders, or psychosis are also at elevated risks for suicide. So these are very important risk factors, being male, being Caucasian, and having pre-existing conditions. Those who have a history of self-harm or past attempts are also at a higher risk. There is some evidence of increased risk for suicide after the withdrawal of levodopa or dopamine receptor agonists. So those are important to keep in mind. Possible treatments. Dopamine replacement therapy seems to be a very valuable treatment for Parkinson's disease itself. But it's unclear if this therapy actually helps to reduce suicidal thinking or attempts. Some studies found that psychoeducation could be helpful for short periods of time. Psychotropic medications for the coexisting conditions like depression, anxiety, and insomnia have found to be somewhat effective, as are medications for movement disorders. Some experts believe that ECT, electroshock therapy, can provide relief for depressive symptoms and reduce suicidal thoughts and behaviors. And usually ECT is a last resort type of therapy when medications don't seem to be working and other treatments like therapy don't seem to be working. Support from family and friends are very important, as you know, as well. Here is my takeaway for today. Parkinson's disease is a common neurodegenerative disorder that affects movement and emotional well-being. Depression is very common and places individuals at a higher risk for suicide. Some interventions to reduce suicidal thoughts and behaviors include symptom management and enhancing quality of life as much as possible. Thank you for your time. Keep coming back for more. I'm Dr. Jim. See you soon.